It's a little-known condition that is often misdiagnosed. Up next, what you should know about NPH.
Today we are learning more about a condition. It is called normal pressure hydrocephalus, otherwise known as NPH for short. It's a relatively unknown condition that is fairly easy to misdiagnose. So here to explain more about the condition and the challenges to making a diagnosis is neurologist and author Dr. Adam Mednick, along with Robert Cooper, a patient of Dr. Mednick's, who was diagnosed with NPH, and you really helped him out. So good to see the two of you. Doctor, first start off by telling us what this condition is.
Well, hydrocephalus refers to a buildup of fluid inside the chambers of the brain called ventricles. That fluid is called cerebrospinal fluid. In normal pressure hydrocephalus, what happens is, for unclear reasons, there's a gradual buildup of that fluid usually over the course of many years, because the brain's ability to absorb that fluid becomes impaired. And the reason why it's called normal pressure is that when doctors measure the pressure inside the brain, it's usually normal.
Okay, and that's why you get kind of a strange name, because the term is normal, but it's really a very bad brain problem.
Correct.
Yeah. Right. Let's talk about some of the symptoms.
Well, there are three cardinal symptoms to NPH. The first one is trouble walking, which is why doctors often mistake this condition for Parkinson's disease. And the second symptom is urinary frequency, urgency, and incontinence. Now, that is the most important symptom that the patient has to tell the doctor about, because that symptom is not usually seen with Parkinson's disease. The third symptom, which often happens years after the onset of the incontinence and the trouble walking, is memory impairment. So by the time the memory impairment develops, which could be over the course of 5 or even 10 years, the ability to treat that condition becomes increasingly less. And so that's why it's important to be able to recognize that condition earlier, typically after the development of the incontinence.
Robert, let's talk to you. How did you decide that maybe you needed to see a doctor for this?
Well, for possibly 6 years, I felt falling down, could not get my balance, was losing all kinds of equilibrium. So I ended up in a wheelchair for 3.5 years. And I finally talked to Dr. Mednick, and he came up with this great thing that happened to me, and it was fantastic.
You have the operation, and you literally stand up out of the wheelchair and you can walk.
Right.
That's amazing.
I had the operation, and the next day after the operation, I got up and walked at the hospital 15 feet right after the operation. And the next following day, I was up there and I walked around the nurse's station.
That's fantastic.
Then they ordered that I should have more therapy, which I did, and now I have no fear of any kind.
Oh, that's great. Doctor, talk about the operation that you performed.
Well, one thing I want to say is that the beauty of normal pressure hydrocephalus, it truly is the one reversible form of dementia. This is why it's so important to be able to recognize this disorder, because if it's missed, you're really missing an important disorder. And the reason with what we do in terms of diagnosis is that we look at the scans. You look for the enlargement of those ventricles. There are other studies, notably the spinal tap. We often will take the fluid off the spine and we see if the patients improve. And what we do then is refer the patient to a neurosurgeon, and the neurosurgeon will do approximately a 1-hour procedure with the patient under general anesthetic. They will make a small hole in the skull. It's sort of thin tube called the catheter into the ventricle, and on the catheter, there's a small valve here, and it's approximately in this area right here, and the catheter sits in the ventricle, and the fluid is drawn out through the effects of gravity, and there's a small rotor sitting in that valve, and on the other side of that valve, there's another tube that actually draws the fluid down into the skin, through the neck, and down into the belly. So we're getting rid of that extra fluid, and that's how we reduce the pressure inside the brain. And by doing that, we can get rid of the trouble with the walking, the incontinence, and oftentimes the memory will improve as well.
Well, it's just fantastic. Just a few more seconds left. If somebody wants to get some more information, I know you've written a book about this, right?
Yes.
Tell me the title and where people can get it.
Well, the title's called Normal Pressure Hydrocephalus. The disease was first described in 1965, and this is the first book ever written on the disease.
And you can get it on Amazon, bookstores, things like that?
Yes, you can get it pretty much anywhere on the internet.
Okay. Dr. Adam Mednick and Robert Cooper, thanks, gentlemen, for coming on the program, giving us some
Thank you.
insight on that.
Thank
Really
you.
appreciate it.